Hello, my name is Sonia Contra, and today I'll be presenting on platelet-rich plasma. If you follow professional sports, you've probably heard of athletes receiving PRP injections to treat knee injuries. But what is PRP? PRP stands for platelet-rich plasma, and it's derived from your own blood using a centrifuge machine. After a vial of blood is extracted from a patient's arm, it's placed in a centrifuge machine and spun at a high velocity. As a result, the blood separates into three distinct parts: red blood cells, fat, and platelet-rich plasma. Here, the PRP can be extracted and used for a variety of medical treatments. So, what's so special about PRP? Platelets are an important component of your blood because they are cells that respond to injuries and create clots. For instance, when you skin your knee, part of the healing response is the creation of a scab. You can thank the platelets for that. PRP also contains growth factors and cytokines. Growth factors are exactly what they sound like. They're protein-rich cells that stimulate cellular growth and healing. Cytokines, on the other hand, are proteins that help control the behavior of cells around them by regulating maturation, growth, and responsiveness of particular cells. So, you can imagine why PRP is such an important part of your blood and why it's become such a popular addition to certain medical treatments. The basic idea is that when you introduce concentrated PRP to an injured tissue, that all those important elements of healing will help the body heal itself better and faster. PRP is used in a variety of medical treatments like dental procedures, joint issues such as osteoarthritis, tendon and ligament injuries, and muscle injuries. It can even be used to stimulate hair growth for people who are balding. I'm an esthetician and I work for a plastic surgeon, and I see patients for a wide variety of treatments. I utilize platelet-rich plasma to treat skin that has been scarred or that has a general breakdown of collagen and elastin, which really just translates to fine lines and wrinkles. By definition, scarred skin and skin that's lacking in collagen and elastin is not injured. It's just altered from its original state. So, I have to create an injury. I take this fancy microneedling pen and create what are considered micro-injuries in the dermal layer of the skin. Now, let's quickly talk about some of these terms, what they mean, and why they're important in regards to the PRP treatments. First, let's start with the microneedling pen. This machine is a handheld device that has disposable heads consisting of 12 32-gauge needles conformed in a circle. When activated, the needles perforate the skin like a sewing machine and create micro-injuries in the skin. Now let's talk about the skin. The skin, or the integumentary system, is made up of several different layers, all consisting of different types of cells, and they all perform different jobs. I'm not going to bore you with the entire anatomy and physiology of the skin, although I find it very interesting, but I will tell you that collagen and elastin are made in the dermal layer of the skin. Collagen and elastin are important components because they are strong fibers that are woven together like the weave of a basket. They protect the skin from the day-to-day abuse that the skin receives. As we age, the production of many cells in our bodies start to slow, or in the case of collagen and elastin, they stop altogether. So this is why the skin becomes wrinkled as we age. Scar tissue, on the other hand, is a strong fibrous material that replaces the original tissue after it's been damaged. Creating these micro-injuries that I keep mentioning is important for several reasons. When we injure the skin, the body's natural response is to rebuild that damaged skin by creating new collagen and elastin cells. When the needles hit predetermined depths in the skin, that they are purposefully damaging pinpoints so that the body can regenerate and create new collagen and elastin cells, which will help both scarring and aged skin. The microneedling action serves two purposes during a treatment. It also serves as an intense exfoliating treatment, which helps the skin shed that dead skin that's on the outermost layer faster than the body would do it on its own. By doing so, we reveal new skin, which can further assist in the reduction of scars and fine lines and wrinkles. Now, back to the platelet-rich plasma I was talking about. Remember those growth factors and the cytokines in the PRP? The ones that promote healing and damaged skin better and faster than the body would normally do on its own. With the addition of PRP, the injured tissue that I've created will heal at a faster rate than the body would do otherwise. And with that, I create smoother and younger looking skin. Bye-bye scars, bye-bye fine lines and wrinkles.